Assalamu alaikum, everyone. I have a lovely and beautiful guest with me in the studio today. Before I jump into introducing her, I want to say that she is a beautiful friend of mine, a lovely colleague, and she has an extensive and amazing and inspiring background in mental health. So give me a few moments. I want to do justice to this introduction. Stephanie has been in the field of mental health for over 20 years. And she's been a licensed therapist for over 10 years. She has worked with people who, from the age group of newborns to people requiring end-of-life support. She's worked in the field of she's advocated in the justice system. She's advocated for people with mental health issues in the school system. She's advocated for psych patients in the hospital system. She's worked in-home therapy setting, which I think is so inspiring. You worked with emergency psych, where we got to bond a lot. And you are also an author of a blog where you are helping spread more awareness about mental health, teaching people how to accept and normalize mental health. So, Stephanie, welcome to the studio, and thank you so much for your time.
Thank you so much for having me. I'm very grateful.
Thank you. So let's jump right into the questions. So what I did was that a week ago, when I knew I was thinking mentally preparing for this session, so I kind of posted a story on my Instagram asking about what are people's perspectives about therapy and what are some of the reasons that people kind of shy away from going to see a therapist. Sure. So the ideas and the amazing answers that I got, I basically tried to make the questions somewhat around those. Yeah. So let's jump right into it.
All right, let's do it.
Alrighty. So I guess the first question is the basic fundamental question, which is, does therapy even work? And how is it any different from talking with a therapist, talking with a friend,
sure,
or trying to solve my problems on my own?
You know, I think that's something I get all the time as a therapist, because I'm not just a therapist, right? I'm a sister, a mother, a friend, and many times, when I'm meeting with someone, definitely we have people in our lives that can support us, that can hear us, because what we really want, all of us, we need someone to witness for us, and we need someone to validate that our experience is worthwhile and purposeful, right?
Love it.
Yeah.
To be witnessed and validated.
Absolutely. And, for me personally, when I'm with my girlfriends and we're processing and all the things, and they'll even say, gosh, it's so great to have, a therapy session. And I'll ask them, do you want my therapy hat or do you want my girlfriend hat? Because they're two different answers.
Absolutely.
They're two different perspectives. And I think for our experience and for us to find healing, we need both of those. So I think the answer is, yes, we can heal through our support network, but having a therapist gives us that unbiased support.
Absolutely.
Research-based, evidence-based interactions that we can implement in our life. Yeah.
Spot on. I 100% resonate with you on that it's an unbiased viewpoint.
Yes.
Our friends, family members are going to have their biases, right?
Right.
And it's evidence-based. We know it works.
Yeah.
And after a certain amount of weeks, it says it's as effective as medications. So,
absolutely, great point. Great point. Because I think that's part of the struggle for folks is, it's the showing up, and it's the getting that relief of putting whatever is weighing you down outside of you. And not having to worry about blowback, if you will, from, if it's a family member who might be affected by what you're talking about, or a friend who might be affected or change their viewpoint of you based on what's going on inside.
Love it. I think therapy, as a professional to do therapy, takes so much off you. So I think it is such a valuable, activity that I think it's a service to yourself if you can take yourself to a therapist.
Agree. Completely agree.
So, love it. So the second question is, I think, falling more under the umbrella of stigma. So a lot of people who are listening to this right now are from the part of the world, which is Pakistan, India, so that part of the world, where mental health and accepting that people going to get help for mental health is still not fully accepted. It's not the norm, and there's a lot of stigma around it. Yeah. So the question comes in, do you have to have mental illness to be able to go to a therapist's office? And does it mean that you're not normal, quote unquote, if you go to a therapist's office?
Yeah, I think that is a universal concern for folks, and it's not necessarily are you unwell. You're not a problem to fix or solve, because life is hard.
Yep.
Life is hard, and we all deserve the right to access whatever support we need. And then, just like we talked about before, especially from a therapist, an unbiased outside opinion that can help you sort things out. Just like if you were to, if you were feeling physically unwell, going to a doctor, you're not just going to ask your girlfriend, or your, coworker, hey, what do you think about these symptoms, right? If I have a legal concern, I'm not just going to ask, one of my friends. I'm going to talk to an attorney. So
a professional.
Yes, absolutely. Talk to a professional to get some support, and even in that same aspect of one therapist does not equal the other therapist. There's so many different types of people. So keep looking. Yeah.
Right. Love that. So this makes me wonder of a big question. Do you think everyone needs to go to a therapist?
I think you and I've talked about this.
Yes.
And, controversial or not, but I would say yes. Because I think every person at some point in their life needs to see a physician.
Yep.
And to get, like a well check, I think, as we talked about.
Yeah.
So why in the world would we not want to get a mental health well check?
I love that. So let me just go ahead, sort of describe a little bit for the audience what we mean by well checks. So a lot in the American medical system, which I am absolutely in awe of, that there is a concept of well child checks, and there's a concept of wellness check for adults as well, which is that every 6 months a kid needs to be brought to a pediatrician, regardless of whether they're sick or not, whether they have any, just to come check in with a doctor to see they're on their vaccinations, all of that. Adults come to check in their lab work every 6 months. And those are like required mandatory wellness checks.
Yes.
When it comes to mental health, it's about, you're going to therapy because maybe something's wrong with you. You have depression, XYZ.
Absolutely.
So I love that. And this was almost like a light bulb that lit in me during a conversation just before the recording.
Yeah.
Well, so thank you for bringing that to my attention.
Oh, absolutely. And I think you're just on that point, a lot of times I'll talk to folks, and we just in the setting where we met in emergency psychiatry, right? So people come in a crisis situation, and it's that question of, is this the only time that therapy is helpful? Absolutely not. Yes, it's helpful in that moment.
Yeah.
But I even encourage my clients in an outpatient setting, remind yourself that essentially your hair doesn't have to be on fire for you to come in and talk.
Spot on. Don't have to wait that long for crisis to hit. It can be for just wellness. Absolutely. I'll go ahead share over here. It's a little bit of a self-disclosure. I have been with a therapist for a long time, and for me, it's a space where I reflect, introspect, become more aware of my blinders.
Yes.
Understand myself, where I'm going wrong in relationships, or what I'm doing right also.
Absolutely.
Right?
And same here. I've shared that with you as well. I share that with my clients.
Yep.
Just the simple fact of if a physician told me that they don't see a physician, that would be a red flag for me not to go to that physician, right?
Right.
So as a therapist, I see a therapist because life is hard.
Yep.
And I also see a therapist because it is hard what we do when we're talking to people and absorbing that energy, absorbing some of the trauma. And I deserve a place just like everyone else to be able to sort that out and unpack it.
Absolutely. Got it. Love this. This takes me to the third question, which is that, and a lot of people have brought this up, that especially in a country like Pakistan, it's so hard to find a therapist.
Sure.
And when you do find one, how do you know that it's going to be the right fit for you?
Right.
So,
and I think that's, again, probably a universal concern, but definitely more so in Pakistan because of the amount of opportunities and the amount of resources available, because the stigma of reaching out for support is a struggle.
Yep.
And so I would just encourage people, as I do when they sit in front of me for the first time, that, if you leave here today and I've either said something you maybe disagree with or you just don't feel a connection with me, maybe I'm not your cup of tea. there's so many other therapists available. And
Love
so,
that.
yeah, the main part being, don't give up. You know, and I'm not the best fit for every person. You know, and so maybe that first person you reach out to is not the best fit. It took me a while to find somebody that I felt a connection to, and that I felt comfortable sharing with. And so I definitely understand that.
Love that. I love how you normalize and say it's a universal experience to have a little bit of struggle to find the right fit for you.
Yeah.
So it's not just unique to, let's say, Pakistan, but it's even in America, that it takes trial and error to see who you connect with.
Yes.
I have this thing that's coming to my mind, that there was a mentor who I heard him tell this to other patients, and I loved it. I picked on it, which is he told the patients that, you know what, if we therapists are treat us like a pair of shoes.
Yes.
If one doesn't fit, go on and find the right fit for you.
That's perfect.
Right?
That is so perfect.
So I do think a connection between a therapist and a client is like a connection. It has to be the right fit, right?
Absolutely agree.
Great.
I had a client a couple weeks ago came in and told me, you know, I'm actually here kind of interviewing you. I have an appointment with 3 other therapists, and I congratulated them. I said, "That's wonderful.
That's great.
Yes, I'm glad you're doing that." Yeah.
Good. And so good on your part that you were not offended.
Oh, of course.
Right.
Because our job, we want to be helpful where we can be best helpful. And that's not going to be for every human. But to find that person, you know, you have that right as an individual seeking support. You have a right to find someone that fits you.
Absolutely. Spot on. Love that. I just admire therapists because you all have to do this day in and day out. We get a little bit of break. So I am absolutely in awe of what Stephanie does. And from my experience of working with Stephanie in a very acute setting, the amount of empathy that you can give, I just am in awe of that. So thank you for all the work that you do.
Absolutely. Thank you.
I guess the fourth question, which is a natural progression, which is, some people say that it is such a slow process. Therapy takes time.
Sure.
It's not a quick fix. What would you have to say to that?
I would agree. It's not, because we didn't get in the situations we're in overnight. It wasn't a quick path to feeling in crisis. So it's not going to be a quick path out. However, I do think, and this might be a good trigger for folks to, if maybe it's not a good fit, but I do think if you find someone that you connect with and it's the right spot for you, you will feel some relief just emptying out, unpacking, if you will, whatever brought you to that spot in that moment. Yeah.
Love it. You said that what brought you to maybe a potential crisis moment didn't happen overnight.
Yeah.
So we can't expect to fix it in a quick fix.
Right.
To this, for a second, I'm going to put the field of psychiatry down just for a little bit. For a little bit. That we come in when we can give medications, which is not bad at all.
No.
But I think the real work is done, that medication is an added tool, but the real work is the therapy that you do underneath. Those are the skills that I think that they can carry on for the rest of their life.
Yeah.
Right. So I do think we are a crutch, but you all are doing the real work, which is teaching the skills which can truly be helpful.
Well, and I think, and it's definitely a team approach, right? Because
true.
I will say to a lot of my clients that that are, maybe a little hesitant for a medication route, of a lot of times what medication can do is set the table, if you will, so that you can focus enough to learn those skills.
Spot on. It's a
team.
Because sometimes I think people can be at a spot where they cannot engage in the therapeutic work until they reach a certain point of stability, and medications can help you get to that point.
I totally agree.
But that alone, I think, is not enough. I think
not always, right? There's maybe some very specific diagnoses that maybe starting a medication, but again, back to the question earlier, everyone can benefit from talking to a therapist.
Absolutely.
Yeah.
Love that. And I think we can probably wrap up on the same note, which we resonated so much on, that everyone can benefit from therapy.
Everyone.
Right.
Everyone.
And just how you said, I love it, that how everyone needs to go see a doctor, not only when they're sick, but even when they're well. Similarly, everyone should go see a therapist at some point in their life.
Absolutely. Because it can also be a place of celebration, right?
Absolutely.
of celebrating, look at how far I've come.
Yep.
You know, and look what I'm capable of doing now
Yep.
that I wasn't when I met you.
Yep.
Yeah.
Spot on.
Some of my favorite sessions are that.
Love it. Absolutely. Love it, Stephanie. Thank you so much for being here with us.
Thank you, my friend.
Thank you so much
Yes.
for your time. It means a
Absolutely.
lot. It
My
means
pleasure.
a lot for everybody to have a little bit of like an idea and perspective of how things work here and
Yeah.
how it's not too different from Pakistan. We're human, right?
Yeah, we're a human race. We all have similar needs, right?
Right. Thank you so much.
Absolutely. My
Thank
pleasure.
you.
Thanks for having me.
Thank you.